So let's just say you end up having surgery. You've got your appointment booked in next week, or maybe tomorrow, and you want to make sure that you are in the best possible position to come out the other side in a positive way. Well, you have to acknowledge that white coat syndrome is real. We go into appointments with medical specialists, or any specialist for that matter, someone in authority, and all of a sudden our mind goes blank. We don't know what we're going to say. We've forgotten the questions that we had. We walk out of the treatment room afterwards, or we leave the hospital after surgery, and the questions come flooding back, and we think, God, why didn't I ask that? And that's why I always suggest all of our patients and members who are undergoing these sorts of procedures is make a list beforehand, and the list has to include certain things. Questions such as how did it go versus how you expected. There's always going to be things that might crop up as the surgeon is going through the surgery, and it's not uncommon for them to say, hey, we saw this bit, but we sorted it out. Or actually it went perfectly as expected. Everything's great. Crack on. You want to understand what the prospective recovery time is and what recovery time even means. And we'll get onto that in the next couple of questions. But before we do, you want to also understand what sort of symptoms and things should we watch out for. There are sometimes cases where we have things like disectomies and a little bit of nerve tissue is knocked on the way past, and we have a little bit of tingling afterwards, which is entirely normal and tends to clear up, but it takes a bit of time. Being aware of those sorts of things is important. And then finally, when are we going to evaluate? When am I seeing you again, Mr. Surgeon, in a couple of weeks or months to have a catch up? And what are you hoping to see in me at that point? And then we get to the really important questions, because this gives you a gauge of how to move forwards. Questions like, when will I be able to pick up my toddler, go to the bathroom on my own, get out of a chair, get into the car, walk up the stairs, carry a laundry basket, carry the shopping? You get the idea. Specific things that hopefully you're thinking, go up the stairs with a laundry basket, that's a step up. Get off the toilet seat, that's a squat. Because the biggest mistake you can make when you speak to that surgeon is say, when can I go back to exercise? Because exercise is a whole massive ream of different things. They have no notion of what exercise might mean for you. You might be a triathlete that wants to get back out there on the bike. You might be an ordinary person who just wants to go walk the dog. Those are two very different things. And walking the dog versus just walking with your other half are also two very different things. Because with the dog, you might be pulled off in a different direction, or you might have to go down and pick up after them. Whereas walking with your other half, you're just walking around at body level. All of these things are different. They have different stresses and strains, which is why it is worthwhile stating the specific thing you want to do. So you've got a couple of reference points that you can then, in an educated manner, start saying, that's kind of like my squat. They've given me the okay to pick up my 12-kilo toddler, so I should probably be considering doing some squats before I get to that point to make sure I'm back in the groove.